Lumbar interbody fusion is performed to remove a portion of a disc that is the source of back or leg pain. Like the PLIF procedure, bone graft is used to fuse the spinal vertebrae after the disc is removed. However, the TLIF procedure places a single bone graft between the vertebrae from the side, rather than two bone grafts from the rear, as in the PLIF procedure. Inserting the graft from the side where the facet joint has been removed is an effort to avoid moving or damaging nerve roots during the procedure. An incision is made in the middle of the low back. Surgical instruments are used to remove the entire facet joint on one side in order to allow access to the degenerated disc. A grasping instrument is used to remove most of the intervertebral disc. Removing the facet joint and disc relieves pressure on the compressed spinal nerve, allowing it to return to the proper position. A single bone graft is placed in the disc space from the lateral aspect through the area exposed when the facet joint was removed. The bone graft will provide stability to the spine when it fuses with the vertebrae above and below it. In variations of this procedure, spacers, cages packed with graft material, or ground bone graft material may also be packed into the disc space to aid with the fusion. To prepare for additional fusion along the transverse processes, which will further stabilize the vertebrae, a motorized instrument is used to remove the top layer of the transverse processes. This is the site where the bone grafts for the new fusion will be added. Before bone grafts are added, instrumentation is introduced to stabilize the spine. A drill is used to make holes in the pedicle area of the vertebrae, and screws are placed in the drilled holes. Next, rods are positioned between the screws and fastened in place. The rod and screw instrumentation provides stability to the spine and prevents the vertebrae from moving while the bone graft fusion takes place. Bone grafting can be done with pieces of a patient's own bone, processed bone from a bone bank, or a bone graft substitute. To harvest a patient's own bone for grafting, a second incision is made over the back of the pelvis. Bone is removed from the iliac crest and placed along the prepared site where the top layer of bone was removed. This bone eventually grows in place, fusing the spine and providing additional stability. The incisions are closed and dressed to complete the procedure. Adding the instrumentation with bone graft fusion increases the strength of the spine directly after surgery and may decrease the need for a post-operative brace. Patients often remain in the hospital for 2 to 4 days following the procedure and should avoid heavy lifting, bending, twisting, and turning for 6 to 12 weeks. A posterior lumbar interbody fusion is performed to remove a disc that is the source of back or leg pain and fuse spinal vertebrae with bone grafts. It's called a posterior procedure because the spine is approached through an incision on the back. Instrumentation is used to provide space for placing the grafts and to help stabilize the spine. An incision is made in the middle of the low back. The muscles are moved aside and the lamina portion of the vertebrae are exposed. Cutting instruments are used to remove the spinous process, portions of the lamina, and portions of the facet joints from the back of the vertebrae. Removing bone here allows the surgeon to see the disc and compressed spinal nerves. A grasping instrument is used to remove most of the intervertebral disc, which relieves pressure on the compressed spinal nerve, allowing it to return to the proper position. Next, the vertebrae are prepared for instrumentation. A sharp awl is used to make holes in the pedicles for inserting pedicle screws. Screws are placed through a metal plate and then into the pedicle holes, ending with the screw tips in the middle of the vertebral bodies. Screws and plates are placed on both sides of the spine. 2 more pedicle screws are then placed through the metal plate and screwed into the lower vertebral body pedicles. To prepare for bone graft insertion, the disc space is spread apart by moving the vertebral bodies or applying pressure on the pedicle screws. The screws are tightened to hold the disc space in this open position. 2 bone grafts are then placed between the vertebral bodies. The bone grafts allow for eventual fusion as bone grows beneath the vertebral bodies. In variations of this procedure, spacers, cages packed with graft material or ground bone graft material, may also be packed into the disc space to aid with the fusion. To provide stability to the spine while the fusion occurs, the lower screws are loosened and the vertebral bodies are squeezed together. The screws are tightened in the compressed position, which allows for a tight fit of the grafts in between the vertebral bodies. Small screws called blockers are placed on the pedicle screws to lock the screws to the metal plate. The incision is closed and dressed to complete the surgery. Patients will typically be hospitalized for 2 to 4 days and should avoid strenuous activity for 6 to 12 weeks.